Last week, World Health Organization highlighted the fact that one pharmaceutical company of India had supplied cough syrups to Gambia, in which 66 children have died in the last 3 months. These cough syrups affected these children, their liver, their kidney, their lungs. There was a panic situation inside the country because this pharma company, Maiden Pharma, is a registered company with the Indian authorities. To allay the fears, a member of the Standing Committee of Medicine and Health Products, a very senior official, told the media, nothing to worry. This Maiden Pharma is only licensed to produce medicines for supplying to the African countries, not for supply to any other country, not even for domestic supply. That raised a question. Is the life of people of African countries less important than our own country and the rest of the world? Why companies like Maiden Pharma get away with such products that kill people? That's because African countries have very lax regulation about drugs and medicines. Same thing would not happen in an European country or in Americas. But then question is, do we have any responsibility? We are supposed to be a country, 5th largest economy in the world. We are supposed to be aspiring to developed country status, one of the premier Vishwaguru. So if in this country can't we set up a standard where we make regulation as effective as it is in the Western countries? No. Devesh Thakur, a health activist, and Prashant Reddy, a doctor, they've just come out with a book. Book's name is The Bitter Pill, The Truth Pill, Myth of Drug Regulation in India. What do they tell us? They say that they wanted to look at drug inspectors' report in different states of India. And what did they find? Despite several requests, they did not receive it, and they are not available for public viewing anywhere. What happens? Only 3 states apparently have made it available, that also in truncated form, that is Kerala, Gujarat and Maharashtra. None of the other states have done this. So finally, they had to file an RTI application, and in the RTI, what did they get? After going to the National Commission, they get some handwritten ineligible drug inspector's report. In this digital world, you find they just said we could not make head or tail of what these drug inspectors are going to say. And then they asked for certain investigative reports from the Drug Controller of India's office. And what did they? They didn't get it in normal course, and in an RTI application they say drug investigation reports are untraceable. This is the great country that we are so proud of. If this is the kind of standard, what kind of medicines should come out of the pharma industry? Prashant Reddy and Devesh Thakur tell us, in fact, give us the CAG report, CAG's findings, Controller and Auditor General's findings, which say that 1/4, 1 in every 4 medicines supplied to the armed forces in the country are substandard. If armed forces are plied with substandard medicines, what is the plight of the common man like you and me? We should think twice before we pop a pill.